Hey guys, welcome to the 5th installment of the UWorld Live NCLEX Review Series. We're so excited to be bringing you today a really special one, Psychiatric Pharmacological Medications. So for those of you who may be new, my name is Holly. I am a content developer here at UWorld. I am also a bedside nurse in the CVICU, and I used UWorld when I studied for my NCLEX. If you were here for our session a couple weeks ago, Holly was with me as well, and I'm going to let her introduce herself today.
So as Holly said, my name is also Holly. My background is in pediatric psychiatry, and I'm currently studying to be a primary mental health nurse practitioner.
So we're going to be asking for your input again on questions today as we go through them, and we want to hear from you during the questions, in between all of that, and of course we will have time at the end for additional questions about UWorld, about the content, about whatever else today. And so make sure you use the chat feature. On the single best questions, we will have the poll available. So go ahead and use the poll. That helps us see what you're answering. And yeah, any reminders?
Yeah, just a reminder to keep your video quality at least 720p or higher to prevent blurry picture or video footage.
Awesome. So like last time, Holly's going to be leading us through the questions. I'll help with some of the Q&A and just kind of seeing what you guys have coming in. So as part of that, before we get into the bank, we actually have a question for you guys.
Yeah, so to kick off today's lesson that we're talking about, the first question we're talking about is a mood stabilizing medication that is used in the treatment of bipolar disorder. Do any of you guys have any guesses of what that might be? Feel free to comment those in the chat and we'll let you guys think about that, and then we'll transition to our first question.
Yeah. Let's see. All right, so if you guys guessed lithium, you would be correct. Oh, there we are. So
awesome. So yeah, our first question is about lithium. This is a mood stabilizing medication used in the management of a client who's experiencing bipolar disorder, as described in this question here. So in our first question, the nurse is reinforcing discharge instruction for a client who's been prescribed lithium. So we're looking for instructions that the client should be following. So let's figure out what is the correct instructions. So for our first question here, we look at the question stem. This is the main question that's being asked. And then we see the different answer choices below. So for each of these answer choices, something I like to do as a study tip is to look at from the bottom up. So this way it slows us down and allows us to really read through each answer choice before answering. So we have taking ibuprofen for mild pain relief, we have reporting diarrhea, we have routine blood testing, we have eating a low sodium diet, and then we have drinking at least 8 cups or 2 liters of fluid throughout the day. So if you guys want to go ahead and comment in the chat what options you think might be correct, go ahead and do that now.
yeah. And remember, with select all that apply, it can be anywhere from 1 to all 5 options. So we're not going to tell you how many there are yet, but go ahead and leave them there.
So we're getting some answers in here. We'll give you guys a couple more seconds. And Holly, what does it look like most of the answers have been so far?
It looks like we are mostly getting 1, 3, and 4.
Okay, so let's see if they're correct here. Awesome, you guys got it.
Good job.
So lithium, like I said, was a mood stabilizing medication used to manage bipolar disorder and also in the reduction of suicidal ideation and behaviors. So something about lithium that's important to know is it has a narrow therapeutic index. So basically what this means is that there's a small range between a dose of lithium that is helpful for a patient versus what's harmful for a patient. And so it's really important for medications that have narrow therapeutic indexes to know what that index is and also what symptoms you might see if it reaches those non-therapeutic levels. So with lithium, there is a risk for toxicity if the therapeutic level is exceeded, and it might be like greater than 1.5 is usually the number that we're looking for with that. And that's milliequivalent per liter or 1.5 milliosmoles per liter.
So with these routine blood tests, when we say routine, how often is that?
So those are going to be like usually bi-weekly to begin with, so once every 2 weeks. And then as the therapy continues, it's going to be every 3 to 6 months during the maintenance phase. And before we talk more about that, some symptoms you might not recognize with lithium toxicity are normally with acute lithium toxicity, you might see GI findings or gastrointestinal findings, and so you might see nausea, vomiting, or diarrhea, and usually the neurologic changes are what happen later, or like with chronic lithium toxicity, and those things might be like sluggishness or tremor that we see in these tables here. And so also like this table is saying, the therapeutic level for lithium is 0.6 to 1.2. So anything that might be either lower or higher than this would either create negative symptoms for the patient, or they won't really have any effect with the medication that they're taking. So going on, something that's important to do when you're taking lithium is to report diarrhea to your healthcare provider. Something that like clients taking lithium that already are at risk for is increased urine output, which do you know what that can create, Holly?
Definitely dehydration.
Yes, and so as lithium causes the body to accumulate more lithium, the more that the client's dehydrated. So it's really important to educate the client on drinking at least 8 to 12 cups or 2 to 3 liters of fluid a day. So that's really primary teaching to be aware of. And we talked about the routine blood tests a little bit already. In addition to blood tests, it's also important to monitor the client's kidney and thyroid function, as lithium is absorbed and excreted by the kidneys. And so that's really important to monitor as well. Something else with our incorrect answers, a low sodium diet can actually increase lithium retention, which results in possible toxicity.
Yeah. So if someone's already following a low sodium diet, should they change what they're doing or should they keep it consistent?
At that point, it's really important to keep consistent sodium levels, so trying to keep your sodium levels as within normal limits as possible, just because sodium and lithium have kind of an inverse relationship. So if there's a low amount of sodium in the body, then you're going to have higher levels of lithium and possible toxicity. However, if there's too high of sodium, then you might not have enough lithium in your body and your medication might not be working effectively.
Gotcha. So it sounds like that one might be one you need to work with maybe a dietitian or your healthcare provider on to make sure you're getting a correct amount for other conditions.
Yeah, that's why it's important to have all those blood tests too, those routine blood tests, to make sure that all the levels are exactly where they need to be. The other incorrect option that we have here was taking NSAIDs like ibuprofen or naproxen with lithium, because NSAIDs have the ability to increase renal reabsorption, and so as lithium is excreted and absorbed by the kidneys, this can also result in toxicity due to that increased renal absorption from the NSAIDs.
Awesome.
Yeah, so those are some things we're looking at here with lithium. Again, it's a mood stabilizer with the narrow therapeutic index, which therapeutic index meaning the range between what's harmful and helpful for a patient. And interventions that we're looking for is to increase fluid intake, to prevent dehydration, receive those routine blood tests, and then ensure that lithium levels are within therapeutic range.
Awesome. Yeah, so just a reminder for you guys, right down here is going to be that NCSBN client need. We've talked about the test plan, which is like the blueprint that the NCSBN creates for the NCLEX. That's who makes the test. And so this is going to be where in those subjects it falls, and that'll help you in your studying to kind of get in those specific ones. And then again, with UWorld here, we've got our educational objective, which is our nice little summary. And of course, we always have tables and everything for you. So do you guys have any questions over lithium therapy, lithium toxicity, anything like that?
While we're waiting, we could add this to the notebook.
Yeah, let's do that.
Awesome. So to add this to your notebook, you're going to click on the image, click Notebook, and then we're going to add content here. And we already have it in that mental health note that we made during our psychosocial integrity lesson that we taught on, and so we're going to add that to this here. So now we have the lithium toxicity added too. Okay, and so before we go on to our next question, this next class of medications are used in the treatment of ADHD, or attention deficit hyperactivity disorder. Do any of you have any ideas of what class of medications that might be? You can go ahead and answer in the chat before we move on. So the class of medications used for the treatment of ADHD.
Let's see.
Okay.
Yes, someone we've
Awesome.
got an answer for stimulants. Yeah.
Good job. So our next question we're going to be talking about is the class of medications called stimulants. Okay, so with ADHD or attention deficit hyperactivity disorder, stimulants are the primary treatment used for ADHD. So with this question, the nurse is providing teaching to an adolescent about extended release methylphenidate for attention deficit hyperactivity disorder. So we're looking for the statement that indicates that the teaching has been effective. So we know that right now it's asking us about extended release methylphenidate, so we're focusing on that medication, and then using our test-taking tools, we're going to start from the bottom up, and this time we're going to add treating each answer choice as a true or false question. So starting at the bottom, we have, I will take this medication in the morning before school. I should drink caffeine-containing beverages if I get tired while studying. I may initially gain some weight when starting this medication. And if I miss a dose, I should take an extra dose at the next meal. So we'll give you guys a second to answer in the poll here, and then we'll move on to see if you're right.
All right, looks like everybody is saying number 4.
Okay, let's see if we're right here. Awesome, good job, guys. So attention deficit hyperactivity disorder was something that we also talked about during the psychosocial integrity lesson, but it's a disorder that causes more of a client to experience distractibility, forgetfulness, difficulty focusing on school and work, and often in the home environment as well. Holly, do you remember how many environments you have to experience those symptoms in order for it to be ADHD?
I believe it was 2.
Yeah, that's correct. So usually you want it to be 2 different environments, like home and school or home and work, depending if the client is a child or an adult. So that's what we're looking for with that. And those symptoms can either be inattentive, like the forgetfulness like we talked about, or it could be like hyperactive, like restlessness and stuff like that. So the medication that we're talking about in this question is methylphenidate. This is a central nervous system stimulant used to treat ADHD and narcolepsy, which narcolepsy is having sudden bouts of, like they call them sleep attacks almost, or having those like daytime drowsiness. So this medication can be used for both of those diagnoses. It also improves focus and attention by working on the neurotransmitters dopamine and norepinephrine in the brain. Some side effects we have to be aware of when we're having a client who's taking methylphenidate is irritability, decreased appetite, tachycardia, some sleep disturbances, and we'll talk about those more down here. So as we go into the question more deeply, the answer is extended release methylphenidate should be taken in the morning. And the important teaching on this is that it needs to be taken earlier in the morning in order to decrease the risk of sleep disturbances like insomnia.
So on that one, could you explain a little more the difference between when we see like XR versus IR or ER, different dosings?
So XR, or the extended release methylphenidate, lasts about 8 to 12 hours in the body, whereas the IR, the immediate release, that lasts about 4 hours. So that's really important to know, no matter the medication that you're providing to a client, is if it is an IR or XR release, that's going to be different times that it's affecting the body. So for a client who's taking methylphenidate XR, it's really important that they take it in the morning, like before school, because if they take it too late in the day, they might not be able to fall asleep at their regular bedtime, and their sleep might be disturbed because of that. So it's also important to know that some of these stimulant medications should be taken 30 to 45 minutes before meals due to the affecting absorption with food. But it's really important in general for clients to follow the prescription instructions that were put on there by the healthcare provider, or to ask even their nurse if they had any education questions.
Definitely.
Yeah, so our incorrect answers we have in this one is methylphenidate is a controlled substance. So because of that, if a client does miss a dose, they shouldn't take an extra dose. If you take too much of methylphenidate, you may experience tolerance or psychological dependence, or even psychosis if it's taken in excess. And so don't take extra doses unless it's been something that you've discussed with your healthcare provider. Also, methylphenidate can cause appetite suppression, so you wouldn't see weight gain with that, but you'd see weight loss. So it's really important for clients, especially children and adolescents who are taking methylphenidate, who are still in a period of a time in their lives when they are growing rapidly, to monitor their growth pattern and nutritional status closely. Also, clients who are taking methylphenidate should not drink caffeinated beverages because this can also increase adverse effects, because caffeine is also a CNS stimulant. So you might see more of that, like tachycardia and irritability and insomnia, if you take those together.
Definitely.
So that's our take on methylphenidate. So like we said, it's a CNS system stimulant used to treat ADHD and narcolepsy, and you should educate your clients to take it in the morning, avoid caffeine-containing beverages, and avoid taking extra doses unless your healthcare provider instructed you to do so.
So we'll give you guys a second to put in some questions here, but it does look like we have one first. Someone wanted to know if you could repeat the hours and duration of the instant release and the extended release for us.
Yeah, so the instant release is going to last about 4 hours in the body, whereas the extended release is going to last about 8 to 12 hours. Now, those are specific for methylphenidate, and so if you are looking at different medications that have immediate release versus extended release, those will change based off of the actual medication. But for methylphenidate, those are the times that we're looking at.
Awesome. All right, give a second for some other questions to come in, see if we get any. And if we can't get to them right now, we can always come to them back at the end.
Definitely.
All right, looks like that is our only one for now. So I know we've got another question before we move on to our third item. So if you want to go ahead and ask that one.
Yeah, so for our next question, we're going to be talking about SSRIs. So does anyone remember what an SSRI stands for? And also bonus points if you can name one.
By bonus points, we mean brownie points with us, because
Yes.
that's what we can give you. It's a little bit of a long one, so we'll give you guys a second to type out what you know. All right, so we can go ahead and go on. It looks like we've got some talks of serotonin as one of the words. Definitely, because there's 4 words, have a lot going on, so.
Okay, let's see if you guys are right. Okay, so selective serotonin reuptake inhibitors,
Good job,
or
guys.
SSRIs, are medications that are used in the treatment of anxiety or depression, and it's something that, with depression and anxiety becoming more prevalent in today's world, it's really important for us to understand these medications as nurses, because we're going to start seeing them a lot more within our patients, and it's really important to know what medications are for and also how they're going to impact the client.
Yeah, and like we've talked about before, you know, whether you're in an inpatient psychiatric setting or you are in an outpatient clinic or you are on a med-surg floor, wherever, you know, you're more than likely going to encounter clients who are on different psychiatric medications. And it's important to know interactions, how they work, times, all of that, just because they can have a lot of interactions with other medications and things. And so having a baseline knowledge of that, regardless of your setting, is really important. So,
Definitely.
And good job, guys. I see you all sending them in. I know that it took a second for you to type, so very proud of
Awesome.
you.
Yeah, it's hard things to spell sometimes too. So with this question, another test-taking tip we have for you guys is to focus on what the question is asking for. So this specific question is asking about an adolescent client who's been prescribed alprazolam and sertraline, and what statements indicate that their teaching was effective. And so with this question, it's important to understand what each answer choice is related to. So we'll kind of give an example here in a second, but let's go ahead and highlight the medications that we're learning about here. So starting from the bottom up, treating each question like a true or false answer, and then using our related to. So we have this question: is sertraline used at the onset of panic attacks?
Yeah. So we want to see if the medication, or you know, if maybe in another setting it could be something diet related, it could be other things. Is that specific item related to the rest of the option, or kind of looking at it like, sorry, like, does this apply to this? Or, in regards to panic attacks, where would sertraline fit in? And so you could think of in regards to diet teaching on potassium, where does this fit in? And so kind of using that approach of almost turning that option into a question itself.
Definitely. So with the next one here, number 4, if a client's feeling dizzy or lightheaded, should they immediately stop it? Is that true in regards to alprazolam, or is it true in regards to sertraline? And going up there, we have contacting a healthcare provider if you have suicidal thoughts, not driving after taking alprazolam, and then using no more than 1 alcoholic beverage a day while taking alprazolam. And so as the question as a whole, it helps to kind of put each one into a true or false scenario, knowing what medication is being told as the fact.
Yeah.
So let's go ahead and see what you guys have been saying.
It looks like we have a lot of people saying 2 and 3, and a lot of people saying 2, 3, and 4.
Okay,
So,
let's see if they're correct.
kind of split down the middle here.
Okay, so if you guessed 2 and 3, you're correct.
Good job.
And so we'll go ahead and talk about this a little bit more too for those of you who guessed 4 to kind of explain why these are the correct answers. So as we said, this question is talking about SSRIs and benzodiazepines, specifically sertraline and alprazolam. So panic disorder is actually something that is often treated with SSRIs or SNRIs, which are serotonin norepinephrine reuptake inhibitors, for long-term maintenance, and then benzodiazepines are often used in the in-between period. Something to know about panic disorders are these are intense periods of anxiety lasting for less than 30 minutes, usually accompanied by physiological symptoms. So that can look like chest pain, dizziness, shortness of breath. So the SSRIs are given as long-term maintenance treatment for the anxiety, and they work by inhibiting the reuptake of serotonin in the brain. Serotonin is something used to help regulate mood, sleep, digestion, and adverse effects related to serotonin are also related to the things that it regulates, because sometimes initially when you're taking serotonin or SSRIs, you're going to have some GI upset, drowsiness, or even decreased libido. So those are things to be aware of when a client is taking SSRIs, to kind of monitor for those things as well. So those take about 4 to 6 weeks before they're at therapeutic levels in the brain. And so in the meantime, for a client experiencing panic disorder, it's important to have the client have other medication that's readily available and can also help calm down anxiety in those in-between weeks. So benzodiazepines are often used for that short-term treatment of anxiety treatment. So they are short-acting, which means that they don't need a lot of time to build up in the body, and they also act on the neurotransmitter GABA, producing a sedatory or calming effect in the brain.
So if a client takes the benzodiazepine one day but not the other, are they going to still be able to have the effect, or do they have to take it that day to get the effect of it?
So a benzodiazepine would have to be taken like that day to get the effect. They're used in the acute treatment of anxiety, and so it's not something that should be taken over long periods of time. So we'll talk about this more in a little bit as well. So for clients taking alprazolam and sertraline, they should avoid driving when taking benzodiazepines, or otherwise known as alprazolam is one of those, due to the sedative effect it might cause, or drowsiness. And so this is especially important if a client's taking this medication for the first time, or they've just had a recent dose change, as you never know exactly how the medication will impact your body until you actually take it. Also, immediately reporting suicidal thoughts to the healthcare provider is important, as especially with this client being an adolescent. SSRIs do have a black box warning for increased suicidal thoughts and episodes of suicide in children and young adults during the initial treatment phase. So these are hopefully things that they might happen more often when you're first starting a patient on an SSRI. However, when they continue them, this should hopefully taper off, and it should give them those better mood benefits as well. So that's something to be aware of, and definitely monitoring when you have a client who's taking a newly prescribed SSRI.
Definitely.
So with our incorrect answers, taking benzodiazepines with other CNS depressants such as alcohol or opioids can be very dangerous, as benzodiazepines are a CNS depressant. So with these two things together, it can produce significant respiratory depression and even death. So that's really important to educate your clients on the interactions between those two things, because oftentimes people don't know the severity of that.
Definitely.
Also, benzodiazepines should not be discontinued abruptly. That's why option 4 was wrong, due to the withdrawal symptoms that might be caused as a result of that, which primarily those are like seizures is the main concern that we're looking at there. So if a client does experience any type of like dizziness or lightheadedness with the benzodiazepine, they should notify their healthcare provider. If they're not able to tolerate the adverse effects, and the healthcare provider might work with them to like taper down or slowly decrease the medication so that way they don't have that withdrawal.
Yeah. So instead of just totally quitting it cold turkey, stopping, we want to taper down the dose, all of that. And then someone also asked about dizziness here, and so we would consider that more of an adverse effect than an expected effect. Would you agree with that, or do you see something different?
Yeah, it'd be more of an adverse effect, and that's something that someone would report to their healthcare provider. And it really depends on the type of benzodiazepine that's being used too, because some of the ones that are used just on an as-needed basis, when you haven't taken it routinely, might be okay to not take the next time because it's made to be PRN or as needed. However, with the ones that are being used in the short-term treatment of panic disorder, those ones are being used a little bit more routinely, and so that's why it's important to not discontinue those abruptly. And lastly here we have SSRIs are the medication that should be taken at a consistent time to prevent future panic attacks. Like we talked about, those are the ones that kind of manage our anxiety long term, and they do not treat acute anxiety symptoms.
Gotcha. So on option 5, I know the option was using sertraline for an episode of panic disorder. So the correct answer there would have been alprazolam with that.
Correct.
Awesome.
Yeah, so that's kind of how our like in regards to test tip that we were talking about is important, because if it did say alprazolam, that would have been a correct answer choice. Yeah. So overall, we talked about in this question that SSRIs, a client taking them for the first time should immediately report suicidal thoughts and also take them at consistent scheduled times. Clients who are taking benzodiazepines should avoid the use of other CNS depressants such as alcohol and opioids. They shouldn't drive while taking benzodiazepines, and then also not abruptly discontinue them if they've been on them for that short-term therapy of like panic disorder.
Yeah. And then definitely important on this, making sure your clients know enough of the difference with the medications so that when they are started on like the SSRIs, that they understand it might be a couple weeks before they really feel the effects. And so as prescribed and needed, they can use those benzodiazepines to help them as that medication starts to build up in their system. And then after that, making sure they stay consistent. And even if they're feeling better, continuing to take it, because we don't want to have that drop off or any negative symptoms. So if you guys have any questions, you can leave them for us.
Definitely. And I think that's a good point, Holly, because I think a lot of times people will start sertraline or fluoxetine, other SSRIs, and think it'll work right away. However, it does take those 4 to 6 weeks.
Absolutely.
So it's important that we know that as nurses so that we can help our patients understand that better too.
Yeah. I think we should add our educational objective to the flashcards while we
let's do it.
even our notebook while we're waiting for any questions to come in.
So we're going to highlight that, click notebook, and then let's go ahead and add it right there.
There we go. This is fun. This is the one we started FEC, created July 6th, back when we did our psychosocial integrity a couple weeks ago, and then we're just continuing to add to it now. So, all right, I don't see any questions, so I guess we were just explaining things so well today. You are. So we've got one more question for you guys before we go on to the next one.
And this one's kind of a fun one. So if you guys know, herbal supplements are becoming more and more popular throughout the health field, I feel like. So it's really important to understand what herbal supplements our patients are taking, as a lot of times these are not prescribed and something that they might start on their own. And so it's important for us to know what the herbal supplements are and what interactions they might have. But before we move on, apart from herbal supplements, what are some other examples of complementary or alternative medicines that you guys might think of? Yeah. Can you think of any, Holly?
I would think of acupuncture as an example. Sorry if
that
was what you were going to say, but you can say it too. So we'll give you guys a second to say those before we get into our last item of the day. And just a reminder, these are always recorded and posted on our UWorld Nursing YouTube channel. For later watching, and you can always share them with friends, all of that. So, So do you want to give us a couple more examples of those as we move on to the next one?
Yeah, we talked about herbal supplements. There are also are other supplements that aren't herbal. There's acupuncture. Sometimes they use massage, other things like that. Yoga, I think, could be considered one. Some stress reducing therapies.
Definitely, guided imagery we've talked about a lot, and I know I use a lot with my clients when they're having a lot of pain. So
definitely. And it looks like you guys actually guessed what our next topic is going to be about.
Oh, someone said cupping. That's a good.
Oh, that's awesome.
Very different. I like that.
Yeah, so this question is talking about a newly prescribed medication, sertraline, for a client who regularly takes herbal supplements. So which of these supplements is most important to discuss with a client who's taking sertraline? So to remind us of what this question is in regards to, we're going to go ahead and highlight sertraline here. And then review each answer choice from the bottom up, asking if it's a true or false as in its regards to being most important for a client who is newly prescribed sertraline. Yeah. So we have valerian root, we have St. John's wort, which a couple of you guys mentioned in the chat already. We have garlic, and then we have echinacea. Yeah.
And then something I mentioned before that I always like to remind you of is when you're in your NCLEX, when you're taking your test, you will be getting that whiteboard. And so since you can't highlight and do all the things you can do in the UWorld QBank, we suggest going ahead and, if you want to write out sertraline, if you want to write out different herbal supplements and different things, just to kind of help focus for your brain what they're saying. So it looks like most students are saying option 3, St. John's wort.
Let's see if they're right.
And just as a reminder real quick, we are going to be taking questions that you guys have at the end. So if you think of any during this question, please leave them in the chat and we will keep a running list of things. So
definitely. So like you guys guessed, St. John's wort is the herbal supplement that's important to look for in a client who's also taking an SSRI, like sertraline, like we talked about in the last question. So St. John's wort is a herbal supplement used in the management of depression and anxiety. It mimics the effect of an SSRI by increasing the amount of serotonin that's available in the brain. However, because of this, if it's combined with other SSRIs or other serotonergic agents, then it may result in serotonin syndrome, which is a potentially fatal condition. So serotonin syndrome itself is associated with excess serotonergic activity in the central nervous system. So those are a lot of big words, but basically it's when you combine medications that impact serotonin in the brain together, then sometimes too much of a good thing is a bad thing.
Definitely.
So some symptoms that you might see in a client who's experiencing serotonin syndrome, this is usually something that occurs also when dose changes happen with SSRIs or when you're combining serotonergic agents like we talked about, like St. John's wort or even over-the-counter cold medication or tramadol or other things that have some impact on serotonin. So before giving those things to a client who is taking an SSRI, it's important to look up the indications and the interactions. And if you don't know those things, then asking your healthcare provider.
Yeah. And this is definitely an extra reason why, when we're asking clients, especially when they're hospitalized, and not just what prescription medications are they taking, but what herbal supplements, what dietary supplements and different things, because when we can look at those, we can see in our list interactions. And then also a really nice thing is, once you're in practice, a lot of electronic medical records now will kind of automatically pick up on certain things having interactions or potentials for harm. And so she'll get into it more, but just kind of the teaching that just because it's not a prescription doesn't mean it's not going to have effects on different body systems.
Definitely. And I think a lot of times patients who are taking herbal supplements might not realize that they need to report it to their healthcare providers. Yeah. So that's really important, like Holly was talking about. So like we said, serotonin syndrome is a result of that excess serotonin in the central nervous system. And as a result of that, it produces some pretty dangerous symptoms. So some way I like to remember this is through the acronym MAN. So first we could possibly see all three things. There's not necessarily an order that they may occur, but usually the first one is mental status changes. So a client might start to act more agitated. For A, we might see autonomic dysfunction, so we might see hypertension, increased heart rate, diaphoresis. For N, neuromuscular activity such as hyperreflexia or tremor. And something that's unique to serotonin syndrome too is that the hyperreflexia, or that increased muscle reflexes, also can result in hyperthermia or fever as a result of that increased muscular activity.
And that's where serotonin syndrome can get really dangerous for your body. You know, your muscles are so extra reflexive that they just cannot, they don't get a break. And so your body's going to heat up. And, you know, sometimes if there's too much going on, there's a potential that it's not going to respond to treatment fast enough. And, you know, that overheating can cause cell lysis. It can cause issues with perfusion, all sorts of things. Like you said, hypertension, high heart rate, all of those things. You know, we have a potential for stroke in there. And so we want to make sure we're getting their body temperature cooled down if they do have serotonin syndrome. And if we're recognizing the signs, consistently watching their temperature and watching their heart rate, blood pressure, and kind of managing each part of the specific symptom or sign that's affecting the client so we can keep them the safest.
Definitely. And like Holly was saying, like treatment of that too is focused on that like muscular hyperreflexia, just because of that causing a lot of the other symptoms. So like relaxing their muscles and things like that.
Yeah.
So like we said, that's the way to remember that is MAN, mental status changes, autonomic dysregulation, and neuromuscular activity, which we'll review that at the end too.
And another little fun one for you guys to remember is serotonin syndrome has a bunch of S's in it. St. John wort also starts with your S. So you can
SSRIs.
And SSRIs. So we can just combine all of them together. Just remember the letter S, and you remember that St. John wort is what goes with serotonin syndrome.
Definitely. So like we already talked about, the nurse should instruct the client not to take St. John's wort with an SSRI like sertraline. So with our incorrect answers, the first one is echinacea. This is a herbal supplement used for the common cold or sometimes for flus. However, there's no significant evidence of its efficacy. So this would not be a medication that a nurse would educate the client on who's taking SSRIs. Next we have garlic. It's a herbal supplement that's used to promote digestion, ease stomach pain. You might have heard of the 3 Gs, garlic, ginkgo, and ginseng. These, when combined with anticoagulants or thrombolytics, can increase the risk of bleeding in the client. So it's important to memorize those two. That's another mnemonic that you might want to go ahead and keep in the back of your mind is the 3 Gs for increased risk of bleeding with anticoagulants. Lastly, we have valerian root. That one is used to reduce anxiety and insomnia. It binds to the GABA receptors similar to CNS depressants like benzodiazepines. So the client should be educated if they are taking valerian root to not take with other CNS depressants like benzodiazepines or alcohol, because this could result in respiratory depression. So with this question, what we talked about was taking St. John's wort with an SSRI increases the risk for serotonin syndrome, and then we talked about the clinical manifestations of serotonin syndrome being that MAN or MAN acronym of mental status changes, autonomic dysregulation, and neuromuscular activity.
Yeah, so I wanted to point out on option 1, so we were talking about echinacea as an herbal supplement for common cold remedies. It's important to note that while that's not going to cause serotonin syndrome, if you are taking any over-the-counter cough or cold medication, that includes, and excuse me as I say this word because it's a long one, dextromethorphan, that can definitely cause serotonin syndrome. So you need to be aware, because again, it's over-the-counter, so clients may not think to tell you that they're taking it. And then also, I'll let you get to it in a second, but somebody wanted us to repeat our acronym of MAN, and then we do have a couple questions for you in a minute. So.
Awesome. So yeah, the acronym of MAN was mental status changes, autonomic dysregulation, and neuromuscular activity. And you might have some other acronyms that you've memorized for serotonin syndrome, which is great. So there's never really a wrong acronym when you're memorizing things. We just wanted to provide this one as a helpful tool.
Definitely. So someone wants to know if you take St. John wort, and you're on an SSRI, is it always going to cause serotonin syndrome directly?
You're putting yourself at a greater risk for serotonin syndrome by taking those two things together. So I would say if a client was wanting to take those two things, it would be really important to discuss it with your healthcare provider. However, with SSRIs, the medication itself is going to be more effective and has more research on it than the St. John's wort. So it'd be safer to just take the SSRI.
Definitely.
So you wouldn't really, you shouldn't need the SSRI and St. John's wort. The SSRI should give you enough benefit.
And if it's not, that would be something you would talk with your
Definitely.
healthcare provider about. You may need to increase doses, change medications, or like we talked about in the previous question, bridging it with something like a benzodiazepine while you're waiting for that effect to kick in.
Definitely.
For safety. Okay.
So we can review our test-taking tips on this question because we actually used all 4 that we talked about during this live review. So our first one was that we want to see if there's any keywords in the question stem that are help leading us to what it's wanting us to answer. So for this one, it was what supplement taken is most important. So most was that keyword. Next, we want to look at the answer choices from the bottom up, so to help us read through them slowly and to make sure we take our time when we're answering the question. Then we're treating each question and answer choice like a true and false statement to see if it makes sense. And then we're also treating it true and false in regards to. So for these ones, it would be, is valerian root true in regards to sertraline? Is St. John's wort true in regards to sertraline? And so on. So hopefully those are some tips that you guys can take with you as you're taking your NCLEX exam.
Yeah. And I really like the picture here that we've got. It really shows kind of all of the things happening together. You can actually even see, the clients almost kind of climbing out of the bed here because they just have the agitation. They're hot, throwing the blankets off, all the different things. And so if you can remember that serotonin syndrome just causes the just kind of almost an overdrive of the body, that can help you remember what some of the things are that we're going to be looking for.
Definitely. And we actually have one more thing to talk about with you guys too. So one topic that we didn't cover yet is antipsychotic medication, which obviously is a really big topic in psychiatric medications. And so antipsychotics work by reducing psychotic symptoms through affecting the dopamine receptors in the brain. So dopamine is another one of those neurotransmitters. And with all psychiatric medications, they're all impacting neurotransmitters, so it's really important to understand the function of those in the brain. So by blocking dopamine, this can result in EPS, or extrapyramidal symptoms. So with first-generation antipsychotics, or otherwise known as typical antipsychotics, such as haloperidol, you might have more of a risk for these extrapyramidal symptoms, which that can look like acute dystonia, akathisia, which is like the inability to sit still, Parkinsonism, which is more like pill rolling on the client's hand or shuffling gait, or tardive dyskinesia, which is kind of those uncontrolled involuntary movements like lip smacking or tongue thrusting. And so something to screen for those that nurses do is called the AIMS scale, the abnormal involuntary movement scale. So this is used in order it leads clients through this guided assessment of their movements in order to look out for these particular things that we just talked about in the EPS symptoms. So second generation antipsychotics are the newer antipsychotics that have been created. They're also known as atypical antipsychotics. And so with these, the client is somewhat at risk for extrapyramidal symptoms, but more so at risk for metabolic syndrome or weight gain, which metabolic syndrome can include increased blood pressure, increased blood sugar, and also increased waist size, which kind of goes along with the weight gain.
There you go.
So when you're having a client taking an antipsychotic, it is important to monitor them for those abnormal symptoms so that we can get them the treatment that they need.
Yeah, definitely. So, reminder, we're going to take some questions if you guys have them, so feel free to leave them in there. But while you guys are leaving your questions, could you talk a little bit about SSRIs versus SNRIs? And specifically, I really enjoy how their name kind of tells you exactly what they're doing.
Definitely.
I'll let you explain in there a little more. So
yeah, so like we talked about in the last, the third question that we were talking about panic disorder. We can go back to that here too. So panic disorder is treated for long-term maintenance with SSRIs or SNRIs. So something that's really helpful by memorizing what SSRI means, and kind of one of the reasons that we wanted to quiz you guys in it in the beginning, was that by knowing the name, it also tells you what it's doing in the brain as well. So with SSRIs, like we talked about, they're selectively reuptaking the serotonin reuptake inhibitors. So that means that it's inhibiting the reuptake of serotonin. So that can be a reminder even just with seeing the name itself. And same with SNRIs, those are serotonin norepinephrine reuptake inhibitors. So those not only block the reuptake of serotonin, but norepinephrine as well. And norepinephrine helps regulate mood, attention, and also cognition. And so usually SSRIs are used first, as they usually have fewer side effects, and they also have a better efficacy most times with people. However, it's important with psychiatric meds to understand that each person's genetic makeup is unique, and so some patients might do better on SNRIs than SSRIs, and it's kind of like a trial-error process, but that's the beauty of psychiatric nursing, is it's a science and an art.
Definitely. And this also, I think, applies to, we talked about stimulants and methylphenidate, that, sometimes certain stimulants may work better for some people over others, and sometimes, if you've got issues with like heart conditions, different things like that, you may not be able to tolerate a stimulant, and so there are other medications too there that can have a similar effect on the brain and kind of get you to the same result but a different way. And so it's kind of a cool thing with psychiatric medications is that, like she said, it's a little bit of an art, that you're going to have some different options for different things, and especially as time goes on, we've got our first generation, our second generation, and we've got newer medications that we use and older medications that we stopped using because they have more side effects. And so there's kind of an ever-evolving, just really things to learn and meds to learn about, different things that your clients can take that will maybe help them more with a diagnosis they have or something they're experiencing, and have the least effect on them possible in terms of negative side effects.
Definitely. And kind of like we talked about too, just paying extra attention to those details when you are like providing patients their medication. Is it an immediate release medication, or is it an extended release medication? And also, what other medications are they taking that might interact with it? Usually hospital systems, they all should have programs where you can look up specific medications in order to understand them better and to know what their interactions might be. So especially as a new nurse, I think it's really important to spend time looking up medications before you provide them to your patient. So that way you understand exactly what you're giving them and what the possible side effects or interactions could be.
Yeah. Looks like we do have a question. Someone was asking for a little more about the extra pyramidal symptoms, signs and symptoms. Can you go over again what that phrase really means? And then also, I think you'd given some examples, if you could kind of get into that just a little more.
Yeah, so some of those symptoms that we're looking at, we can switch back to that slide too. So we have acute dystonia, that's affecting the muscles. So a lot of times with extrapyramidal symptoms, they're all affecting like the muscular involvement in the brain. So the akathisia, like we talked about, that's when someone is not able to sit still. Like it's like they it's more of an extreme restlessness than the restlessness you might see with a client with ADHD. And it's also something that like the client was not experiencing before, so it's like a change in status for the client.
Definitely.
That Parkinsonism, you're going to see that I think a lot more with the antipsychotic medications with EPS or extrapyramidal symptoms, and that looks like a shuffling gait or like a pill rolling motion with their hands, which we can show that too when we have our video back up
definitely.
here.
Move on a little bit.
Yeah. And then tardive dyskinesia, that's another classic symptom of EPS, and that's uncontrolled involuntary movements, which can look like a lot of things, but generally you're going to see the lip smacking and tongue thrusting. Those are kind of like the classic signs to be looking for in a client who's taking antipsychotics. However, again, those are most common with first generation or the typical antipsychotics.
Definitely. So yeah, I think the big thing to remember is that EPS or extrapyramidal side effects are going to come with your antipsychotic medications, or they can come with, excuse me. And when you think about them, just think really about movement, and it's kind of like the body's just ready to go. And so, like you said, it's not going to be something that was present before. Not being able to sit still, it's not like a client who's experiencing or diagnosed with ADHD. It's going to be a physical compulsion almost. And same with the other symptoms, that it's just moving and grooving, basically.
And it's kind of, because antipsychotics work by affecting dopamine receptors in the brain, sometimes it can affect it in the wrong way and then block the dopamine in the brain, and it's the blocking of the dopamine that creates those extrapyramidal symptoms. So that's something that with all medications is they can be helpful or they can be hurtful, kind of like that therapeutic window that we talked about with lithium. So it's important to monitor the client carefully. Because another thing is, as nurses, we're a lot of times the first people to recognize the adverse symptoms that our clients are experiencing. So it's important for us to know what those adverse symptoms are and also be able to report those to the provider when we see them.
Yeah. And, with if you're experiencing EPS, depending on the medication, depending on the client's condition, things like that, you may be able to switch to something else, but for that client, that may be the only medications that's working for them. And so you may sometimes have other pharmacotherapy introduced that can help them. So if someone is having, the inability to sit still, that restlessness, we can use things like beta blockers or even benzodiazepines, because both of those are going to kind of slow things inside. And things with like all these other
benztropine or
yes,
Crogentin
I'll let you get into this one. This is your
yeah, benztropine or Crogentin is another one that's used when a client's experiencing those symptoms, and it kind of just helps regulate that dopamine more so that they can have the calming effect and not as many of those like extra movements.
Yeah.
That's kind of a good way to remember the EPS is just extra movements is something that I think about.
Definitely.
Extra pyramidal symptoms, extra movements.
Yeah, so again on these, it's just more of we don't want to be having our clients, we don't want too much polypharmacy going on, but it would be up to them and the healthcare provider of really determining, what's worth getting through the symptoms and pushing through versus, switching medications versus even just adding on like some of these that we've talked about to help. And so that's really going to be individual per person. That's never going to be the same across the board for everybody. And all that. So we got our last call for questions here. You have anything else you wanted to say on these? Or?
I think we're good.
Okay. So we will go ahead and hop out of the bank now. So we went over our test taking tips. We got some questions asked, and that pretty much covers it. We're almost at our hour, and so So I just want to say thank you guys so much for joining us today. We've been having a great time. This is week 5 with these. Next week is actually going to very sadly be our last of this series, but we're going to have a fun one with it. So
what is next week's topic?
Thank you for asking. So next week is viewer's choice. I know last week we put on our Instagram story, we did a question sticker and let you guys submit some responses. And so we've picked some items from there, but we still want to see what you guys have to say. Make sure we've got everything covered. I know we've got some EKGs, we've got some priority questions, all of those, and we're also going to give you a little NGN preview.
Ooh.
So again, our UWorld Nursing Instagram, on our story, we will have that question sticker. So if you guys want to give your suggestions for what we cover this, or even eventually in the future what you want to see, we'd leave them there. Yeah, we really want to hear them because that helps us get to the right items and get to the right teaching for you guys, and where you've got knowledge gaps and what's really pertinent to you in your studies right now.
Definitely. And with that too, we do offer our subscriptions 30 days, 60 days, and 90 days. So they're really great for those short-term studying spurts you might have right before your NCLEX, or also if you wanted to study throughout your whole nursing school, we have enough material to last you those whole 2 years.
Yeah, we've got subscriptions up to 2 years, even if you want to get those with or without those self-assessments we've discussed.
Definitely.
All those. And so we're always available on our social channels. We'll comment back to you here on YouTube if you get some questions. You can send us a DM on Instagram. Anywhere you can find us, you can always send us an email. But someone from our social media team will respond, or if it's a super specific nursing question, you might get one of us responding.
Yeah.
So with all of that, looks like we have covered all our questions for today, and I thought this was really fun. We got to kind of do a little bit more of a specific teaching here, and I know I really struggled with this topic when I was in school, so I hope this is helpful for you guys. And again, it's going to be posted later, and other than that, we will see you next Wednesday, the 27th at 2 p.m. Central Time right here on the UWorld Nursing channel. So,
awesome. Yeah. Well, thank you guys again so much for watching, and until next time, happy
studying. Bye, guys.